Hey guys, welcome back to Medical Coding with Blue. It is Q&A Tuesday. I have a whole list of questions, so let's go ahead and dive right in. Number one, what do I mean when I am referring to the real world coding is different from book or school coding? How are they most different? So what I mean when I say this, because I've mentioned this on a few videos, is that when you're working in a textbook, it's going to give you textbook examples. It's not going to use different words or like different expressions to put across whatever it is it wants you to code. It is literally going to give you the textbook words so that you can look it up. This is completely different from what happens in the real world. Sometimes, and I use calculus and stone as an example, okay? Sometimes a provider will say stone, but when you look it up in the book, you can't find it under stone, you find it under calculus. So this is what I mean when I say that. Real world is completely different, and a lot of times they're not going to give you cut and dry things. You're going to have to figure this stuff out on your own. And when you're looking through like the documentation to find out what happened with this patient, sometimes it has to be clarified with a query, and other times a good and investigating coder will be able to figure it out on their own. But if you can't figure it out, it's totally fine to do a query. But that's just something, that's what I mean by that. I hope that's clear now, because I've explained it, but I think I'm not doing a good enough job of explaining what I mean when I say that. But when you are in school, basically school, the whole purpose of being in medical coding school is to teach you how to navigate the book and what are the basics, okay? When you get out in the real world, it will be completely different, because your facility is going to have certain rules. Certain insurance companies have certain rules. There are different things that you have to do when you are looking at a documentation. Some facilities, you're only going to code certain things, and certain facilities you're going to code certain clinics, and certain facilities you're going to do, whatever the rules that they have there. That's also what I mean when I say real world coding is completely different. Okay? So hopefully that answers that question. All right, number 2. What computer or laptop do I recommend for medical coding? Or if like you're a student and you're doing online stuff. I am not technically savvy, guys. Case in point, I literally point and shoot my phone to do these videos. I do have a camera. I've used it before. Somebody complained on one of my other videos that I was talking too low. I thought I was talking loud enough, but I guess it helps to have a microphone. I'm not technologically savvy, so I'm like the worst person to ask when it comes to like what electronics to get. The only thing I can tell you guys is to go to like some electronics store like Best Buy, and see what they would recommend. I would recommend something that has plenty of memory, so this way you're not running into any issues with downloading any apps or anything like that. That's the only thing I can suggest. Because I'll tell you what, my laptop is quite old. It's like 2014 or 2015. Maybe 2015. I'm not sure. I don't even remember the last time I got it. Clearly, I need to get a new one, though, because it would really help with, doing these and sort of doing editing and everything. My TVs are old. I have a LG flat screens from like 2015 probably. Maybe 2014. That's how old they are. But hey, they still work. That's how I look at it. It still does the job. So I can't complain. I am not technologically savvy. And even my phone that I used to shoot on was really old. Okay, it was a Note 4. Okay, I went from a Note 4 to an S10e. Okay, that's the phone I use now. So I hate getting new electronics. I do. So I put it off as long as I can. So again, just ask somebody that would be like working in an electronics store that would be able to help you better than I can. All right, next one is, what are some other jobs new coders can take? There's applying with medical records if you can't get into being a medical coder right away, which we've discussed that it is difficult to get a job as a medical coder right out of school, because a lot of times they want you to have experience. And now I do have a theory on this, okay? So my theory, okay, this is my theory, just my theory of why it is so hard to get a job as a brand new medical coder is because a lot of times, because we get paid so much money, and again, don't ask me how much money medical coders make. Go to the Department of Labor, dol.gov, and you'll be able to look up medical coders in your area, because like I said, different regions are going to start their coders at different rates. Okay, but we make very good money coming right out of the gate, and we do very well. And a lot of times, if you just have your credential and you don't have a college degree, you're doing very well for not having a college degree and just having a credential as a medical coder. I'm just saying. And they're going to want you to know what you're doing. So if they're paying you all this money, they want to have the most bang for their buck, right? So that's why they want you to have, that's the only thing I can think of that they would want you to have experience, because they want somebody that already knows what they're doing. To me, if I had my way and I had my own company where I could hire people, I would hire brand new coders fresh out of school, because those are the most hungry. Not to say that seasoned coders are not hungry, because hello, case in point. I am constantly thirsting for knowledge. So, but again, it just depends. I would like to work with brand new people who are not set in their ways, like they don't have habits that are hard to break. Sometimes when you get veteran coders and they really know what they're doing, it's almost a needle in a haystack, because sometimes people just don't want to learn things. They get very complacent and set in their ways, and if they learn a certain way, they don't want to deviate from that, and they don't want to open their eyes to new things. These are just things that happen to veteran medical coders. So just because they've had so many years of experience doesn't mean that they are able to do everything, okay? Because certain coders will start in one clinic and that's where they feel most confident, and that's where they will stay. Sometimes they will not expand their horizons. They just want to stay in that same spot. And so if maybe like their supervisor is not forcing them to grow, that could be a part of it too. So it all depends, but that's my theory. That's my take on why they want you to have experience and time in before you start working, because they don't want to have to train you. They don't want to have to train somebody who's making as much as we do right out of the gate, But again, if I had my way, I'm a brand new coder. Oh, welcome. Let's learn together. That would be my thing, but we'll see. So that answers that one. Oh, but other positions that you can apply for if you can't get a job right away as a medical coder, the medical records department, because obviously you're working with medical records. And if you are already in a position in a hospital or a doctor's office, and if they need a medical coder, and oh yes, by the way, I'm a medical coder. Hello, who has experience now? You have experience working with medical records now. You just need to get your foot in the door with being a medical coder. Okay, and that's a good way to make connections. So the medical records department, medical billing, because a lot of times billers do not have to be certified medical coders. And to me, if it would be helpful if billers were certified medical coders, because then they would know and understand. I've had instances where medical billers who are not certified medical coders have kicked stuff back to me and told me that I was wrong. And I look at the documentation, I look at the codes that I selected, and I have to educate them as to why I selected what I did. And I have to show them coding clinics and things like that. Everything that supports my application of this code down to the book. Taking the book physically there and showing them. And they're like, oh, okay, well, we didn't know. This is why it would be helpful if medical billers were coders as well, especially if they're going to kick things back to the medical coders. But a lot of times medical billers are processing paperwork. That is their primary function. But they do have certain people that will look through if there's a denial or whatever, and they'll just kick it back thinking that maybe the coder selected the wrong code. And this is why having a credential already would really help. So that would make you look good. Or a reimbursement specialist. That is also another position that can, you can potentially benefit by being a medical coder already and being a reimbursement specialist. And then they can be like, oh yes, she's a medical coder or he's a medical coder. And, he should be able to help you, That's just my take on that. The next question is, okay, and this is a money question, okay? So I will answer this one because I like the way it was phrased. So the way it's phrased is this: for a medical coder who applies themselves, are there financial rewards like bonuses? Are your wages stagnant over time? Do you get incremental increases? And then I made a note to myself to talk about sign-on bonuses and then raises having to do with performance and bonuses. All right. So here's the thing. We do very well right out of the gate with what we make, okay? I got a substantial increase from where I was when I got my first job. I made decent money at the cancer center, but when I went to my second job, when I had to move away, it was a substantial jump. I mean, it wasn't a few dollars. It was a jump, okay, in pay. And then when I got to where I currently am, again, it was another jump in pay. So there was, it wasn't a small amount. It was a pretty good size amount. And I will let you use your imagination on that one. But some people get very lucky and they apply for positions where medical coders get sign-on bonuses. And I guess it depends on what they're looking for and how badly they need somebody in that area, or maybe it's an area that nobody wants to go to, or maybe it is an area that people want to go to. I know that there was positions way back in the day when I was looking, there was positions in Hawaii that had sign-on bonuses. But there is a caveat to those bonuses. You had to stay a certain amount of time and things like that. So there's always that, and they're everywhere. I mean, and if you get really good at what you're doing, and if you have a high accuracy rate, that's something that's looked at as well, because you can obviously put that on your resume and you can talk about your accuracy rate and what and your ability to maybe teach and work with providers and things like that, because that is a skill. Being able to teach and talk to providers is a skill, because not a lot of people like to do that. There's people that will do anything and everything to stay away from providers. I am more hands-on, but this was not something that I was comfortable with right out of the gate either, because my thinking way back in the day was, these guys went to medical school. They don't want to know anything that I have to say, And I've talked about Dr. X, and Dr. X is a doctor. I don't use his name, so I say Dr. X. I refer to him as Dr. X because for his privacy, but he was very instrumental in helping me to, open my eyes and be like, no, he, because of him, and I say because of him because, and I'll tell you a little quick story, and I'm sorry if you've already heard this. So a liaison for the hospital came by, and he said, and I'm going to make it real quick, and he says, which one of you is the coder for Dr. X? And I was like, oh, that's me, because I shared my office at the time with my partner at the time. And he's like, yeah, he says that you don't talk to him and that you've never given him feedback. And I'm like, what? He's like, yeah, he says that he would like more feedback from you because you don't talk to him. And I'm like, what is he talking about? I'm like, I've sent him emails before, and I was very defensive, but then I thought to myself, I've put on the emails, if you have any questions, please let me know. I sent him like maybe one or two, maybe three at the most, emails of like, oh, this was a really awesome thing that you did on this encounter or something, you know what I mean? It was something really good I was giving him a compliment on. And I guess I wasn't doing it enough for him, And so I was just like, okay, well, he said that, he really did say that. He's like, yeah, he says that you don't talk to him and he would really like some more feedback. I was like, oh, okay, well, I'm going to fix this up right now, because I was mad, And so I went over there, I went knocking on the door, and then, he turns around, he gives me this big smile, and he says, hi. And I go, hi, So I said, I heard from a little birdie that you have a problem with my communication. And I said it just like that, you know. And he's like, well, no, I just would like for you to talk to me more. And I'm like, talk about like what, you know, because you're one of my best providers that I never have to worry about. You document everything like you're supposed to. You very rarely make mistakes, you know. He goes, but I think I can maybe learn some more from you, you know. He goes, I would really like to know if there's anything I can improve on, you know. So I'm like, well, okay, because I'm like, am I gonna have to like really look for something, you know? And but then after a while, we got to having this developing a good rapport. And you know, he started asking questions, and he would stop me in the hallway and he'd say, hey, I had this situation happen, and what about this, and what happens when this scenario comes up. So I was like, okay. So I would talk to him a little bit more. Well, over time his documentation started getting better and better and better. You know, it was good in the beginning, but now it's just really phenomenal. I mean, his documentation is very good. It's stellar. And it was all because we started talking to each other, you know. And so seeing that and building from that good rapport to other providers, and thinking, okay, well, maybe they really do want to hear from me. Maybe they do really want to know what I have to say. Because I told him that. And I was like, I didn't think that you would want to hear anything I had to say. He's like, no, I really want to learn from you. He goes, because I don't know anything about coding, and you're the coder. So, and I'm like, okay, well. So now, you know, and he continues to do wonderful. He's like I said, he does really good with his documentation, and I've used some of his documentation as examples before. You know, of course, taking out all the patient information when I'm showing it as an example. And I mean, it's just all about really good communication, and you know, doing that, and having those good relationships, and being able to say, hey, I can communicate with providers, like I said, is a skill, you know. And so but yes, there are rewards for having high accuracy rating, for you know, improving a clinic's performance, because I've done that. I've done that more than once. And so it's just like, and people sit up and take notice when, you know, when they're going from really like low numbers to like, okay, now we've improved, because why? There's a coder in there who actually cares. So you carry that reputation with you. And you can get bonuses for, like I said, moving to odd places. And and because I've done so well with multiple clinics, it's not just one clinic, it's not just orthopedics, it's neurology, rheumatology, pulmonology. These were clinics that, rheumatology, pulmonology, and neurology were clinics that I was given because these were clinics that really needed help. And so they did notice that. I was given a bonus for that, and it was a very nice size bonus. It wasn't something to sneeze at. This was a nice size bonus. And are there people in other companies who get more money than I do? Absolutely. But yes, my supervisor did recognize that I did do a good job. And, you know, in turn, it makes her look good as well, because, you know, it is a team effort. I say that all the time. It's not just me, you know. And I do get shy when they say, you know, oh, well, you know, Miss, you know, Miss Blue is really helping the clinic. You know, I do get shy when that happens, because it is a team effort. It's not just me, and I always say that all the time. There is no I in team, you know. But yes, those being dedicated and standing out and performing well are often rewarded. That is something that maybe you know, your organization, if you find out that, you know, they do reward handsomely, well, you always want to be able to apply yourself whether you're getting money or not. And that's the way I've always looked at it too. If there was sometimes there's not always bonus money, you know, and I always look at it like that. I perform well regardless, because it's not about me. It's about my providers, and it's about the patients. That's how I look at it. When I take myself out of the equation and it's all about somebody else, you know, this is a selfless thing. And, you know, you are you can be rewarded, you know, and not just that, you get days off, you know, there's also days off awards as well, you know, if that's something in your organization. Okay. But yes. And then the next question is accreditation important when choosing a medical coding school? Yes, particularly with the American Health Information Management Association. There is a list of approved schools, or you can put in the name of the school, like the trade school or whatever, into AHIMA and see if that is accredited through them. You do have to have that in order to sit for certain credential exams with AHIMA. Okay, now I don't know about AAPC, so you would have to look on their website for that information. Okay, number 6, is age an obstacle for getting into medical coding? No. I would say no, because I've known people who have started at age 60. One of the ladies was in her 60s, and she's still a medical coder today, and she's in her 70s now. And she survived ICD-10, the change over to ICD-10. So if she can do it and you're in your 60s and you're wanting to do something, this should not be an obstacle for you, because you cannot be discriminated against for your age in the workplace. That is a law. You cannot be discriminated against. If you are able to do the job, if you're qualified to do the job, you know, that is, you know, the age should not be a factor in that. Okay. It is all about applying yourself. So even if you are getting a lot of doors closed in your face, remember, I was in my late 20s and I was getting a lot of doors closed in my face. So, you know, you just have to be in it to win it, and you have to be in it to really be dedicated to getting a job, because the first part is hard for anybody. You know, if you are not in a place where they're offering externships and things like that, or like job placement, it is hard. And those schools that offer job placement after you get out of school are very few and far in between. So that's something that you'd have to ask them. Okay, but that answers that question. And number 7, why do you have a CCA and not a CPC? Somebody asked me this. So, CCA, the Certified Coding Associate, is through the American Health Information Management Association. CPC is a Certified Coding Professional, or Certified Professional Coder, I'm sorry. Certified Professional Coder, offered through the American Academy of Professional Coders. Now, I got my credential through AHIMA, which is a CCA. I'm very proud to hold my credential, okay? I do not see a reason, personally, for me to go to another association and get credentialed through them when I already have a credential that is well respected. Not to say that the other one is not. I'm just saying CCA is nothing to sneeze at either, even though it is considered entry level, because this is for people who generally do not have a background previously with medical. You know, I didn't go to college. I did not go to, you know, a 4-year degree or 2-year degree. I didn't do any of that. I went to a school that was approved with AHIMA, so that's how I was able to take the CCA. AHIMA credential tests are some of the toughest in the industry. I will say that. And it is not easy to pass these exams. The pass rate for first-time test takers is really, you can check the statistics on the website. It is very tough, you know, but to have tough exams means you have tough coders. So, you know, that's something to consider. Like I said, I do not see a reason. I'm sitting on my foot. I do not see a reason to have credentials through both associations when I am perfectly happy where I am. I do have a lot of things going on in the background that I'm not discussing on the channel just yet. But just rest assured, I am taking steps to advance. Okay, so I will leave it at that. And I'm talking faster because my phone shut off on me yesterday while I was filming. I don't want it to cut off on me again. So I'm almost done with the list. All right. So what do you mean by my quota is 90 per day? Is this total for all specialties that I have all together? Or is this per day? Is this per the month? Or what is it? So 90 per day, the average, okay, 90 per day, or it's 12 an hour, okay, because I'm in a specialty clinic. All of my clinics, orthopedics, podiatry, rheumatology, neurology, and pulmonology are all considered specialty clinics. When you have specialty clinics at my facility, the quota is the average of 12 per hour, okay? We do take time out during the day for things like meetings, or if there's a one-on-one, or if there's something else going on like education, we can take time out for that. When you take time out, that means you're not coding, okay? So if I took an hour out, for that day, and it's 12 an hour, all I'd have to do is come up with, 78 if I was coding a 7-hour day, so, it just depends. But the average for that 78 encounters would be 12 per hour. So that's, and I just did mental math, so if it's wrong, I don't think it is, but, like I said, when you are working in a day, and my supervisor did have a step-by-step on how she wanted me to work, which was by the day and working through all the clinics. But that's not efficient for me. So for me to be efficient, I have to work my way, and so when I started doing it my way, I wasn't struggling to meet my quota. I was able to whip through and get everything done like I was supposed to do. So, once she saw, that I was doing that, and I was getting much more efficient, and it was much more better for me, then she sort of backed off and let me do whatever I wanted to do in terms of that. I more than exceed my quota per day because of how I run my clinics. So, but yes, it is just 90 encounters. It's not by the clinic. It's not by whatever. It is however you, in my instance, however I am deciding to run that day. If I want to do all 90 encounters for one provider, if I happen to have 90, which is ridiculous, why would I have 90? But if I've been on leave or something, and I have 90 encounters for that provider, if I want to do that one provider all day, I can. I just need to hit 90 encounters average. And if I don't happen to make it that one day, maybe I do 80 that one day. And the next day, if I do 100, well, then I made up for the 80. So then if you average the 2 days, it's 90 per day. So I still continue to meet my quota. This is why I try to exceed my quota whenever I can, because if there's going to be days where I get hit with more complex charts, then that's something to consider. So I'm going to go ahead and wrap this one up. I'm going to shoot another video today to talk about the other ones because I don't want my phone to cut off on me. So I will be back for a part 2. But I will see y'all in a little bit. Bye!